So thank you. I'm really happy to be here and to be sharing this topic with you all, and excited to see what questions you have and any ways that you have been working with this kind of material or are interested in working with it. So I'm going to be talking about polyvagal theory and its relationship to working with pain. I'm a physical therapist and yoga therapist. I have one book that I co-edited with Shelley Prosko and Neil Pearson, Yoga and Science and Pain Care, Treating the Person in Pain. One of my chapters is about polyvagal theory, and another one is about the social and spiritual aspects of well-being and the science behind it, as well as working with it through physical therapy and yoga therapy. And then I have a new book coming out in April with Routledge called Understanding Yoga Therapy, Applied Philosophy and Science for Well-Being, which goes a little deeper into the philosophy, but also talks about what we're going to be talking about today, which is practices for regulation, practices for interoception, and practices for resilience, which we probably won't get into too much today. I'm also an assistant professor at Maryland University of Integrative Health in the Masters of Science in Yoga Therapy program, as well as teaching a few courses in the Integrative Health Sciences. So what we're going to be doing today is giving an overview of polyvagal theory and this idea of how underlying neural platforms or nervous system activations promote connected physiological, psychological, and behavioral states. And really the significance of this being is instead of our interventions being directed to just a physiological thing or just a psychological thing or a behavioral thing, we can look at accessing the underlying autonomic nervous system activation to affect all these at once. So when we're thinking about whole person healthcare or integrative health or the biopsychosocial spiritual approach, we can see how this perspective helps us to work with the individual in that truly integrative whole person way. So in that, we'll be talking about a continuum of autonomic responses and how to promote autonomic regulation and a wider window of tolerance to varied states. I'll talk about interoception and its relationship to polyvagal theory. I am going to speak a little bit to eudaimonic well-being because it does relate to a way that we can work with regulation and just the science behind meaning and purpose and social connection and its influence on our health is really powerful. And then I'll talk about some practices to make sure that some of what I speak to is immediately applicable and interesting, hopefully. So just to give a wide overview of the autonomic nervous system and why it's important. So the autonomic nervous system really helps us to have synchronistic and parallel systems-wide communication between our bodily systems and our brain. There's connections with our autonomic nervous system to all the other systems, our cardiovascular, our respiratory, our endocrine, our digestive, our immune, our musculoskeletal, all have an integrated effect through this communication of the autonomic nervous system, as well as with emotion, memory, and thought. So the autonomic nervous system, when we can learn how to change the activation or regulate it or cultivate resilience, then we can really look at how we're both evaluating the person and creating a unified response to physiological health, psychological health, and behavioral health. We're going to be looking at this idea of a continuum of autonomic response from relaxation to mobilization. So in older views of the autonomic nervous system, there was this kind of dichotomous or antagonistic relationship that people talked about, where on one hand we have the sympathetic nervous system with the fight or flight, the mobilizing for danger, and on the other side we have this parasympathetic response, this rest and digest, this relaxation response. However, this idea of them being antagonistic or dichotomous hasn't really been found to be true through many years. So for example, our organs are often innervated by both sympathetic and parasympathetic. So any of our organs can be in parasympathetic dominance, they can be in sympathetic dominance, or they can have a co-activation of both so that it creates this continuum of our level of activation or our level of relaxation. So in newer models, and one of these is polyvagal theory, it talks about the importance of the vagus nerve. The vagus nerve is a cranial nerve. 80% of it is sensory or interoceptive. And as I said, we'll talk about interoception a little bit more in detail as we go. So the vagus nerve is 80% sensory, meaning that it's getting information from our organs and from our internal systems, that information is going from the organs to the brain. The other 20% of the vagus nerve fibers is motor, and in that it's a primary conduit of parasympathetic response, so that it's really enacting that relaxation response. So this is a picture, and you can find many of these on Google, where it shows the vagus nerve coming from the brainstem and all the interactions with the organs, the lungs, the heart, the liver, the stomach, the intestines. So you can really get a sense of how many connections there are through our body. So one of the things that Dr. Stephen Porges, who developed polyvagal theory, found is that the vagus nerve in the brain stem doesn't have one origination site, but it has two. So one of them is called the nucleus ambiguus, and most of the fibers from the nucleus ambiguus go to places above the diaphragm, so the heart and the lungs. And it's responsible for what's called heart rate variability. Heart rate variability is a way that people measure the amount of parasympathetic dominance on the heart. So when you're in relaxed states, what happens is when you inhale, the heart rate goes up, it increases, and when you exhale, the heart rate decreases. And so if you were to just, measure your heart rate by taking your fingers on your neck or your wrist, and if you're in a relaxed state, you'll find this natural variability. So in relaxed states, we have heart rate variability, and this is mostly enacted through the nucleus ambiguus at the brainstem. Then we also, the other origination site of the vagus nerve is on the dorsal motor nucleus, and that's mostly subdiaphragmatic, so intestines, stomach, those organs. And it's also responsible for the parasympathetic response, or the slowing down of the system. So to get into interoception a little bit more in detail, interoception, historically, it was originally defined as the internal awareness of body sensation. So like your ability to feel your heart rate, your ability to feel digestive processes going on, or even kind of hear them. But more recently, it's been expanded upon to be a much broader concept. So when people talk about interoception now, they talk about this complex pathway through where we get afferent sensory information from our organs and from our emotions, our cognition, our memory. I'm just going to make sure that everyone's okay chat-wise. So interoception historically was simply the receiving of body sensation. But more recently, just to repeat myself, more recently it's more complex to really mean the afferent sensory information that we get from all of our organs, but as well as a perception of emotion, cognition, and memory. So interoception includes the brain structures that interpret and respond to information. It's the receiving, the appraising of body sensation, emotion, memory, and cognition. So interoception now is much more widely understood as the whole process of taking a moment to sense inside your body, to notice things like heart rate or breath rate, to sometimes feel the digestive processes, but also to just experience inner sensation, like the qualities of heaviness or darkness or coldness or warmth that we can perceive through inner awareness, as well as our emotions, our cognitions, and our memory. The ability to be sensitive to interoception and the accuracy with which we identify sensation is important to self-regulation, as well as in conditions such as pain and addiction. So people can either have low sensitivity, meaning that they don't really perceive any sensation, or they can have oversensitivity, where they feel every process that's happening inside of them and they perceive those as danger. And they can also have a mismatch, where they perceive inner sensation as certain emotions. And we'll keep talking about that. So neuroception is the subconscious detection of safety or danger in the environment. So this is a term coined by Dr. Stephen Porges. And what it was about was noticing how the nervous system is constantly evaluating our environment and creating a response of either safety or danger. So for example, in this moment, based on how tired I am, when I've eaten, what I've eaten, what my surroundings are like, how safe I feel, or my nervous system is detecting a level of safety or danger. If I perceive safety, my nervous system is going to activate a relaxation response. If my nervous system perceives danger, it's going to activate a certain level of sympathetic response. So that this happens subconsciously without us even knowing it. Whenever we enter any situation, our autonomic nervous system has activated in a way that was responsive to either perceived danger or safety. And when that happens, we have a simultaneous physiological, psychological, and behavioral response, which we'll look at. So this is a chart that I developed based on Dr. Porges's work, as well as Damasio and Norm Farb. And it looks at this idea that at any moment, we're getting interoceptive and exteroceptive information. So through my 5 senses, I'm getting information through sight, sound, smell, etc. Through interoception, I'm feeling inner body sensation, and that creates an autonomic nervous system platform, a level of activation of my nervous system, which then creates a feeling. So those feelings are not emotions. They're more things like clenching, jitteriness, hardness, softness. They're abstract, non-conceptual words that describe an inner body sensation. And from whatever is happening in my autonomic nervous system and my felt sense, I have a psychological response, like an emotion or a cognition or a belief, as well as a behavior. So if I've started to experience inside my body a sense of agitation, a sense of clenching, a sense of hardness, my sympathetic nervous system begins to turn on, then my emotions and thoughts might be worry, fear, anger. My behaviors might be tension, it might be yelling or something like that. So polyvagal theory talks about 3 neural platforms that are the main neural platforms that engage in response to perceived safety or danger, as well as 2 combined neural platforms. So these are the ones we're going to talk about. So defensive mobilization, social engagement, defensive immobilization, and then the combined ones of safe mobilization and safe immobilization. So I have them written here, and I have this expressed a couple different ways because sometimes it's easier to see this in different ways. So the social engagement neural platform is what we think of as the relaxation response. So it's made up of the nucleus ambiguous vagal motor neurons, as well as others. So our nerves never really, activate solely by themselves. There's usually a network that happens. So in the social engagement network, the part of the vagus nerve from the nucleus ambiguous activates alongside other nerves. And this links our heart rate variability with restorative physiological states, with a greater vocal prosody, a calming quality of voice, attunement to human voice, relaxed and calming facial expression. We'll talk about this a little bit more. And then mobilization neural platform can be anywhere from safe mobilization to defensive. So it mobilizes the system for action along a continuum of creativity and play to fight, fight, or flee. And we'll talk about this. And then immobilization is the last one, which is the most passive response to threat. It's a slowing down of the system to what is necessary for survival. And I think it's probably easier if I go into the other ones. So the first neural platform to speak about is the social engagement neural platform. So this happens in a neuroceptive response to safety. So when we perceive safety in our environment, we're going to have a physical response of physiological relaxation. Muscle tension relaxes, our digestive processes are activated, and we have good heart rate variability. So these are relaxed, restorative states. Our emotional qualities would be that are more likely to happen from that, or more accessible, would be calm, peace, or equanimity. And our behavior is going to be things like compassion, empathy, social connection, and engagement. So what this is really saying is that when we're in this physiologically restored state, we're more likely or have more access to these emotions and these behaviors. So that if we're wanting to help someone build compassion or help someone build empathy or social connection or calmness or peace, when we activate the social engagement neural platform, that's going to be more likely. In defensive mobilization, that's in the response to danger. There's a physiological mobilization of all the systems of the body to get ready to action. Because what's happened is that our being, through exteroception and interoception, we perceive the need to mobilize. So our muscles will get tense, our heart rate goes up, our blood pressure goes up, our respiration goes up. The emotions that are more likely or more accessible here are things like anxiety, worry, agitation, anger, and the behaviors are the fight or flight behaviors. The third neural platform, so this is something that Dr. Porges talks about, and something that many psychologists have understood in their own clinical practices, that in response to life threats, so really immense danger and life threat, there's another response that can happen. So instead of going into sympathetic or even freeze, there's another slowing down that can happen to the bare amount needed for survival. So the example that can be utilized is like when a cat catches a mouse and the mouse's blood pressure, heart rate, temperature goes down so much so that the cat really thinks the mouse is dead. It's different than freeze. It's a real slowing down of all the bodily resources to the bare needed for survival. And then the cat can let the mouse go, and then the mouse goes away. So that this is in response to life threats, and there's a shutting down or slowing down of the systems. This is associated with emotions such as dissociative disembodied states, and as far as behavior, this is death feigning or collapse or loss of consciousness. In response to these three main, in addition, to these three main neural platforms, there's also what's called safe mobilization and safe immobilization, with the idea that these neural platforms can be co-activated. So whenever our social engagement system is co-activated with the sympathetic, we have things like play, creativity, and dance. So for example, when you're playing a sport or when you're dancing or when you're in any creative endeavor like writing or anything, singing, there's a certain amount of sympathetic activation that's happening because your muscles are more tense, your breath rate might be higher, your heart rate might be higher, but you still perceive safety. So and this is kind of in line with the whole idea of the stress performance curve, where there's a certain amount of sympathetic activation that actually can increase our dexterity and our coordination and our quick thinking and our problem solving, but we're not overwhelmed by the sympathetic activation. So this is safe mobilization. In something like yoga, which I work with a lot, this is seen in doing any kind of posture, like an active posture, like a standing posture or a bridge posture, where naturally the muscles are tense, the heart rate goes up, the respiration goes up, but we're asking for them to have a relative slowing of breath or to maintain calm states of mind. Then we have safe immobilization. So this is when the engagement of the social engagement system happens alongside that dorsal vagal complex. And so this is like in states of stillness or meditation. It's about the capacity for someone to experience greater and greater levels of stillness, but to still perceive safety. So self-regulation is the conscious ability to maintain stability of the system by managing or altering responses to threat or adversity. One of the examples of this that I thought was really interesting is in aerobic exercise. Sometimes like that you can work with something called anxiety sensitivity, so that the person gets to experience while they're walking on a treadmill or a bike, a stationary bike, they can experience the same symptoms they have in anxiety of increased heart rate, increased blood pressure, muscle tension, respiratory rate, but they're also being asked to notice that they're in an experience of safety. So in self-regulation, we're helping the person to experience, to notice when they've experienced something as dangerous that's not dangerous, when they've misinterpreted that, so that they can begin to notice when they're going into overwhelm of the sympathetic or overwhelm of the dorsal vagal, and how to maintain the experience of safety within that. So the autonomic nervous system is really key to regulation because it connects our physiology, our psychology, and our behavior. So autonomic dysregulation is any imbalance of the sympathetic or parasympathetic nervous system. So this can be prolonged sympathetic states such as allostatic load, a prolonged stress response, chronic pain conditions, and I just listed some here. I have the research, I have some resources slides at the end, But I also have here our book, Yoga and Science and Pain Care, has all of our resources in it as well. So chronic pain conditions such as fibromyalgia, rheumatoid arthritis, headache, irritable bowel syndrome, low back pain, neck pain, shoulder pain, have all been associated with autonomic dysregulation and demonstrate different kinds of decreased heart rate variability. Fibromyalgia patients specifically have demonstrated persistent autonomic hyperactivity at rest and during stress. There's also possible associations between autonomic dysregulation and nervous system sensitization, and dysregulation has been associated with pain intensity. We're going to talk about this idea bottom-up and top-down processing as ways to improve regulation. So this is from our book, and it's just showing like a diagram of this idea that autonomic dysregulation and chronic pain can be part of the pathogenesis, a biomarker, or combination of the two, meaning that it makes sense that in chronic pain that you have autonomic dysregulation. Chronic pain is an experience of, is often an experience of you perceiving danger. And so your autonomic nervous system is going to be towards the sympathetic response or prolonged sympathetic response. In addition, prolonged times in autonomic dysregulation can also be a contributor or part of the clinical picture of pain. So chronic pain can be the stressor leading to autonomic dysregulation and diminished resilience, or it can contribute to the development of chronic pain through diminished resilience. So improved regulation, so the ability to self-regulate, and by regulation, what I mean is to cultivate the relaxation response and really the social engagement neural platform, is associated to many positive health benefits, including the ability to decrease allostatic load. So greater vagal regulation of the heart, which is measured through heart rate variability, is correlated with many positive effects to health, higher resilience to stress, differential activation in brain regions that regulate response to threat, healthy and adaptive interoception, motion and attention regulation, greater flexibility in responding to challenges. So when we look at how we cultivate regulation, we want to look for how we can cultivate physiological states of homeostasis, positive psychological states, as well as pro-social behavioral states. We're really looking at how to activate the social engagement neural platform, as well as a wider window of safe mobilization and safe immobilization so that the person doesn't get overwhelmed by stimuli. So there's top-down neurocognitive-based techniques. So this would be anything like meditations or intention settings that really start with cognitive processes and cascade down to effects on physiology. Bottom-up processes are neurophysiologically based, and they're things like breathing and movement, which start in the body, but then have a cascading effect to psychology and behavior. So one of the top-down approaches that is really interesting to look at is this idea of eudaimonic well-being and eudaimonia. So the word eudaimonia comes from Aristotle. Sometimes, you know, I know that the word eudaimonia can be difficult, but I find it really helpful to learn words that have a meaning that's really complex to help wrap people's minds around what we're doing. So I found this term to be really useful for people to understand. Eudaimonia is about living a flourishing, well-lived, well-purposed life. For Aristotle, it was like when you reach the pinnacle of what it was to be a human being, that's when you would have achieved eudaimonia. He said that to achieve eudaimonia, it was really about living in alignment with one's values. And it wasn't like a rigid set of values that someone else put on you, but it was really like your own value-based ethical inquiry, where you would look at how do you live your life in alignment with what you consider to be kindness or generosity or patience or acceptance. Aristotle talked about eudaimonic happiness as opposed to hedonic happiness. So eudaimonic happiness was a steadfast type of contentment that didn't fluctuate with external circumstances, versus hedonic, which was a constant fluctuating emotional experience. In research, eudaimonic well-being is measured through several different constructs. So the question asks for things such as the person's self-acceptance, if they feel like they're growing, their ability to feel authentic with their own values, quality and meaningful social relationships, meaning and purpose, alignment with values, self-actualization or self-realization, and environmental mastery. There's this really just great body of research on eudaimonic well-being. And I think because some of these topics of social relationships and social isolation and meaning and purpose, they can be really abstract and a bit esoteric. So being able to call upon the body of research that really shows the real physiological effects is really powerful. So the absence of eudaimonic well-being is has been found to increase the probability of all-cause mortality, independent of factors of age, gender, race, physical inactivity, and other conditions like cardiovascular disease, cancer, and stroke. Meaning that when someone is connected, and we'll look at particularly meaning and purpose, that they have decreased all-cause mortality independent of these other factors that we often think about. Eudaimonic well-being is associated with decreased allostatic load, decreased stress response, salivary cortisol, pro-inflammatory cytokines, lessened cardiovascular risk, while hedonic well-being has minimal effects. So what's really cool and powerful is this idea that eudaimonic and hedonic well-being are both effectively like these feelings of happiness and feeling good. However, it's only eudaimonic well-being that has a change on biomarkers of the stress response. There's a reduced risk for a number of diseases with eudaimonic well-being, such as Alzheimer's, mild cognitive impairment, stroke, myocardial infarction, and the potential to transform habitual reactions to positive and negative stimuli to more adaptive and constructive ones. So they found that there's decreased amygdala activation and more engagement of higher cortical structures in response to negative stimuli, and sustained activation of reward circuitry in response to positive stimuli. There's this one of the most powerful bodies of research with eudaimonic well-being is in this measure of meaning and purpose, and they found a downregulation of gene expression profiles affecting inflammatory and immune function. This effect was stronger than that of perceived social isolation. So social isolation has been found to increase inflammatory and diminish immune function related to this gene profile, and the effect of meaning and purpose is stronger than that. In addition, this effect on inflammation and immunity is also sensitive to eudaimonic and hedonic well-being. So the importance of this steadfast contentment or this connection to meaning and purpose is really all the way to our gene expression profiles and inflammation and immunity. If we look at specific to pain, eudaimonic well-being is related to, especially meaning and purpose, is related to a lower level of fatigue, a lower level of disability, pain intensity, pain medication usage, which is particularly important now when we look at opioids. It's related to improved well-being, patient function, adjustment to chronic pain, depressive symptoms, and life satisfaction. In particular, the domains that have been most important when caring for pain, for living in pain, has been purpose in life, self-acceptance, positive social relationships, and environmental mastery. Research has looked at people with fibromyalgia have a lower sense of eudaimonic well-being than healthy controls. And the 4 out of 6 scales that were scored lowest were these: the environmental mastery, purpose in life, positive relationships, and self-acceptance. So when we look at eudaimonic well-being, just to make that a little bit more practical, there's many different kinds of reflections and meditations that we can use. So in working with clients as a physical therapist and as a yoga therapist, often I'll have on my intake form, what is it that brings you a sense of purpose and meaning? What do you enjoy doing? What brings you a sense of contentment? And that can be part of the care plan, whether that is walking in the woods, spending time with their cat or their dog, or writing, or whatever it is, listening to music. What is it that provides them with that sense of a meaningful life? I actually really enjoy using Aristotle's practice. So he calls it the golden mean. And so it's this idea that you could take any value, any ethic, and you could put it on a spectrum of the excess and the deficiency. So if you took something like humility, you could say an excess of humility was not taking up for yourself, not having confidence in yourself, whereas deficiency in humility, would be being narcissistic. So you would have to ask yourself, here's the excess and deficiency. what do I consider the middle, and where do I veer? Do I veer a little bit more towards the excess or the deficiency, and how would I find the middle? So you could take any value that's important to you, kindness, compassion, patience, acceptance, and you could say, like, what would it look like if I were to have too much of this? What would it look like if I were to have too little of this? What do I think the middle is? And then how do I work in my life in a way to embody that? So as far as through yoga, I also work with this to the body, like, is there a body posture that brings you to that sense of the middle? So they get to also feel that experience in their body. I do group classes. Actually, there's this really nice yoga study called I'm a good person, or no, I'm a nice person when I do yoga. And it talks about how in group classes, people often enjoy them because they develop quality social relationships. So while it's not enough just to stick people in a group and expect them to feel social connection, oftentimes in small group classes, people will naturally form those connections. Particularly, I have friends that teach yoga for stroke survivors, and so they'll get together and really talk about their experience of their illness, as well as just having this positive experience with each other. Any kind of meditation that helps to cultivate greater self-acceptance, such as compassion or loving kindness. I often find this is very difficult to do with people who are living with pain. Often it's easier for them to do it thinking of someone else in mind that they feel compassion or feel loving kindness with. It can be an animal, it can be a person, it can be whatever. But that gradually we build that capacity to create the meditation with someone else in mind, and gradually bringing it home to saying it to themselves. So yoga, this was a paper some colleagues and I wrote, and it talks about this idea of a lot of times when people think of yoga, they think of postures. And then when people think about applying yoga to conditions, they think about, oh, here's some exercises for this physiological piece. Here's, meditation for the autonomic nervous system and those kinds of things. So what we were really exploring was yoga has a philosophical context. And when we apply yoga through that context, what we're really hoping to do is facilitate eudaimonic well-being. So this chart right here talks about how in the experience of illness, pain, or disability, people can have a lived experience, meaning that their relationship to their body, mind, or environment is one that perpetuates suffering. Likewise, suffering can create a relationship to my body, mind, and environment that perpetuates or makes worse my illness, pain, or disability. When yoga is applied within its philosophical context, it's about this development of discriminative knowledge, noticing the difference between all the fluctuating stimuli of the body, mind, and environment from one's essential nature as whole and complete, and as contentment and equanimity. When discriminative knowledge and ethical inquiry through, they call it the yamas and niyamas, but it's things like kindness and patience and contentment, there happens to be an intentional reorientation of one's identity. The word dharma in yoga is about this inner and outer harmony that comes when how I'm living aligns my inner sense of purpose and meaning and values with those outside of me, that in a way that supports both the individual me and my community. So asana, pranayama, and meditation are given in context with that value-driven ethical inquiry and dharma, so that the person begins to shift their relationship to their body, mind, and environment to one of eudaimonic well-being. So often what I'll hear from people through the process of yoga is that, like, someone with multiple sclerosis will say, I came to realize that I'm not just a person that has multiple sclerosis. That's just a part of me, that I'm more than that. I'm more than my diagnosis. Or someone with pain will begin to see that while they still might experience pain and it might fluctuate day to day or moment to moment, that they're not their pain. So there comes this disengagement with the diagnosis. Yoga has been shown to increase eudaimonic well-being in one small study, but often in several larger studies, it's been shown that, people often start yoga for more physical reasons, but they often continue or adhere for more spiritual reasons like this. So if we're looking at adherence to physical activity, this is a really unique gift of yoga. So, and I know I want to speak broader than yoga as well. So, so top-down regulation happens through working with these meditations, working with these reflections, and those kinds of things. But we also have bottom-up regulatory techniques. So, there's studies that show in lab and movement analysis that different body positions are related to different emotions. So for example, happiness is related to rising, light, expansive, free-flowing movements. So if I'm wanting someone to help experience that, instead of going through the mind, I can go through the body. With many people I've worked with, particularly in pain, often doing these meditations and these reflections seem inaccessible. Like they can kind of fake it, but the whole fake it till you make it kind of thing doesn't feel great. So I find the bottom-up techniques really powerful. That when you can create an experience in the body of contentment, patience, acceptance, loving kindness, compassion, then it challenges the person's belief that it's not accessible for them. So then they can begin to remember in their body what it feels like to access those states, and they can come back to them again and again. We can use body position and movement also for autonomic nervous system activation. There's like a couple small studies that talk about how a posterior tilt activates parasympathetic state, but we can also look at doing either like slow rhythmic or held postures to help create a relaxation response. And of course, pranayama or breath techniques very directly affect our parasympathetic response, helping us move from a sympathetic to a parasympathetic. So a growing body of research shows that yoga practices do enhance this activation of the parasympathetic response and really the social engagement neural platform. So the way that Dr. Porges and his colleagues are measuring the social engagement neural platform is through this measure of heart rate variability, through healthy interoception, through testing the muscles of the inner ear to see if someone can attune to human sound, as well as some things about vocal prosody. So yoga has been shown to help improve heart rate variability, to help improve healthy interoceptivity, including healthy body awareness, positive psychological and behavioral states like compassion, greater resilience, self-concept, lessening of dysfunctional coping mechanisms, and that there's this combined effect on attention, affect, and autonomic regulation. And some studies that look at compassion and eudaimonic well-being. So when we use any of the tools we have in a body-based therapy, we can use meditations, we can use reflections that facilitate a sense of meaning and purpose. We can help the person find what that might be for them. We can also use breath techniques and movements. One that I've kind of talked a bit about regulation, like this idea of cultivating the social engagement system, but in talking about that wider window of tolerance idea, we can also cultivate resilience. So often I think about resilience as moving as a couple of stages. The first stage is really moving between neural platforms. So helping someone find those states of regulation where they feel like they have a calm body, a calm mind, and they are experiencing things like compassion and loving kindness. But then helping them to experience mobilization of their system, but still with that calm mind, calm imagery, compassion and loving kindness. And then in the first stage of resilience, moving back and forth, going from a relaxed state to an activated state to a relaxed state. And then as they get comfortable moving back and forth, we can gradually do practices like holding bridge or doing a meditation walk where they're actually activating their system while maintaining that sense of calm. So what we're really looking to do is facilitate this autonomic regulation and social engagement neural platform. So I've seen a bunch of questions come through. Let's see. So I have a bunch of resources as well. And most of these resources are in the Yoga and Science and Pain Care book, in both the Polyvagal theory chapter as well as the Eudaimonic Wellbeing chapter. And then my new book coming out, Understanding Yoga Therapy, Applied Philosophy and Science for Wellbeing. Stephen Cole is this NIH researcher who's looked a lot at that gene profile with eudaimonia and the effect on inflammation and immunity. And then I have other studies as well that look at that. So hopefully those can be helpful. And then I want to answer your questions. I'm excited to see them.
Thank you so much for that. That was really interesting and a lot of information in there. So we have lots of questions about can we see the slides? Can we download the slides? So, but one of Michael's asking a question. How do you measure? It was in a slide sort of near the beginning. How do you measure heart rate variability?
Yeah, so for heart rate variability, they look at what's called respiratory sinus arrhythmia. So heart rate variability can have a lot of different components to it. So what they're really looking at is respiratory sinus arrhythmia. So they use electrodes, and they use like HeartMath does it. HeartMath is one of the tools that measures heart rate variability that people often know about. But I know Dr. Porges' lab is using another one right now. But they'll use electrodes to measure the beat to beat and interbeat fluctuation in heart rate.
Thank you. And just to remind people who are wanting to review the presentation again, is that we have recorded it and we will send it out. So you're going to be able to listen to this presentation in a couple days. Okay, next question from Jennifer. Has any research or connection been explored between eudaimonic well-being and those patients diagnosed with failure to thrive?
Diagnosed with what? Failure to
thrive.
Thrive. That's a really nice question. That'd be a really good study. We should do that. I don't, I haven't seen that. I haven't looked for that term in particular, but I haven't seen that. The research I've seen in eudaimonic well-being has more been in mortality. And there's the Harvard Grant and Gluck study, I think it's called, which is a big longitudinal study about purpose and meaning. But they've been more about mortality as well as like gene expression profiles with inflammation and immunity and pain, but not failure to thrive. I haven't seen that.
Okay. Okay. What else we have? Okay, Cheryl is asking, you mentioned self-regulation. Can you also speak to the importance of co-regulation?
Yeah. So co-regulation is, so especially with the social engagement, so with Dr. Porges' idea of the social engagement neural platform, the idea is that these relaxed physiological states where we demonstrate good heart rate variability is co-activated alongside both the control of expressive and receptive domains of communication. So that while what I've talked about a lot is more like internal practices to activate the autonomic nervous system in a certain way to experience the social engagement neural platform, another possibility way to do that would be from the outside in. So that when you're talking about things like co-regulation, the idea that when someone is able to perceive safety and that is activating it from the outside in versus the inside out, if that makes sense.
Yeah, Cheryl, maybe you can comment back on the question if that answers your question, or if you'd like a little bit more info on that. Okay, thank you. From Madeline, do you have any suggestions, for example, breath, etc., to help people with pain move out of the freeze response? And then the second part of the question is, did you say that defensive immobilization is not the same as freeze response?
Correct. So like the freeze response is as a co-activation of sympathetic and parasympathetic, because like because you have the cortisol and all of that coursing through your system of the sympathetic, but you're also immobilized. So that would be a co-activation more of sympathetic and defensive immobilization. So the dorsal vagal and the sympathetic. What was the first part of the question?
Do you have suggestions to help people with pain move out of the freeze response?
Yeah, okay, sorry. And so moving out of the freeze response, So I'm going to say this in two different ways. So it's interesting because in yoga philosophy, they talk about moving out of those states of like dissociation, lethargy, through activation of what they call rajas, or activating postures. That in order to get that state of equanimity or contentment, you can't go from freeze to equanimity. You actually have to create some movement first. So I would say that's the kind of approach I use with people, where from the freeze response, trying to get some activation of the system in healthy ways, like safe mobilization before we come into social engagement. So actually doing movement, doing a little bit more activating breath, like longer inhalations, to get them out of the freeze into the mobilization, so then we can come into social engagement.
Okay, thanks. Madeline, if you're wanting more specifics again, just follow up in the questions. Okay, just to follow up on the heart rate variability, do you measure that in your practice?
I don't. I know people that do, and I think I'm talking with someone right now who's looking at trying to integrate heart math into the clinical practice. I would like to at some point, but I haven't gotten to that yet.
Okay, thank you. Okay.
So I would say I measure more about relaxation response through breath rates, through the relaxation of musculature, and the subjective experience of calm and ease.
Okay, and just as a follow-up to that, in the chat, Mark has entered a link for Thought Technology, which is a Canadian-based company that builds medical-grade biofeedback devices measuring all kinds of physiological response, including heart rate variability. So,
oh, cool. And that's something that that people could use in their personal practices.
Yeah. Okay, a question from Tanya in the chat. Could you speak to the role of the therapeutic relationship in activating the social engagement system?
Yeah. So that kind of goes a little bit alongside the idea of co-regulation, that that when we help, I'm going to say it in two different ways. Like, so when we as a physical therapist or yoga therapist or whatever you are, when you're demonstrating relaxed and calm states, that the person is able to perceive that, and then through that same idea, they're receiving the social engagement neural platform, and then they can begin to access that more easily or more readily. The other thing that is really powerful about the therapeutic relationship is that someone learns that it's safe for them to be activated. So they learn that that like even when they're mobilized through their system, they might have a sympathetic response, or they might have safe mobilization or safe immobilization, but they learn to have that in relationship to another person. So that in itself is a really powerful tool for the person to learn how to be in relationship with different activations of their system.
Okay, now this is a good question. Could you share a story of one of your clients and how this approach helped them in relation to fibromyalgia symptoms, for example?
Yes. So one, I'm going to do two because I always have two. So one story would be a woman who had she had a history of migraine. She had really difficulty with going to sleep and staying asleep. She also had low back pain. So she was, and she was, whenever we did things like standing postures or things that would really strengthen her body because she needed stability, she would often go more into pain. So over time, she was able to perceive the sensation that she was interpreting as pain, and to see it more as like activation of muscles. So we'd talk about every time she felt activation, how she noticed that. Was it sharp? Was it dull? Was it diffuse? Was it localized? Was it heavy? Was it light? Like what was her interoceptive sensation of that? And through that, she would begin to be able to discern like safe from unsafe movements. She was able to go into postures, like do standing postures for a little longer, and to speak to something feeling activated versus something feeling painful. So she was able to really change the articulation of sensation, and to build more tolerance to sensation. And then like another person that's kind of a similar and might be a better example, she was someone that had low back pain, and she had had a history of some trauma, but so what we did is we found like first this idea of like what brings a sense of soothing, what brings a sense of regulation. And for her, that was like she experienced like in the middle of her abdomen like this wide open hypervigilant eye. And to soothe it, she envisioned like when she had these three dogs, and whenever she pet her dogs, they would like start to close her eyes. So she would visually use that image to soothe herself whenever her pain was experienced. So we would do that in postures that felt safe. And then over time, we did that in positions that felt a little bit more dangerous, so that she was able to be with sensation while still creating sensation of regulation or calm.
Interesting. Okay, thanks for that. We've got 3 more questions here. What are your thoughts on any difference between co-regulation with a spiritual figure, for example, divine force, and a real life human being or pet?
I think they're all good. It's whatever like works for the person, and what's most important is that they feel it in their body. So often, like first, they are using something outside of them for that sense of regulation, whether it's a spirit entity or a cat. And either way, I find that to be really powerful and really great. But then in order for it to become something that they can continuously really depend upon, it needs to become a felt sense. Like I feel that sense of relaxation or ease or comfort or safety in my belly or in the back of my body, a sense of expansion, a sense of warmth. But being able to bring it into a felt sense allows it to become stronger, more tangible, and more reliable.
Okay. Okay, here's a comment from Cheryl, who says that she's a somatic therapist, and that what she's really learned about from polyvagal theory is that self-regulation is difficult to attain without first having the experience of co-regulation with another stable nervous system, for example, infant or primary caregiver. So can you comment on that?
Do you mean like I got confused by the last sentence. Like, are you talking about attachment, or are you talking about?
Cheryl, maybe you can clarify. Do you want me to read it again?
Yeah, can you read that one more time?
Okay, so self-regulation is difficult to attain without first having the experience of co-regulation with another stable nervous system. So I think the question is like, if you haven't had that, can you?
Yeah, that hasn't been my experience. And my experience is that is actually the opposite. Like it's easier to regulate yourself. Like if you've been someone that has never been able to regulate, and you've never had safety in regulation, and you didn't have a safe home, you didn't have a safe primary caregiver, like you never knew what it was to regulate, it's actually really threatening to do that in relationship with another person. There's this really wonderful quote by Stephen Porges, and I think it's in his chapter in the Oxford Book of Compassion Science, but it says something about yoga and other contemplative practices. It says it's slightly different than this, so I'm going to misquote it. But it says something like yoga and contemplative practice might supersede the need for social regulation by connecting to a greater sense of oneness. So I actually, I've talked to a few of my friends who work more with psychological trauma. And I think because my experience is with more chronic pain, and I know that they go together, but that a lot of my people are very body-based trauma and body-based chronic pain. that it doesn't ever create a dissociation, but like having them connect to greater senses of oneness, but not one-on-one, like not with an actual other human, is actually very safe for them. It's something that they can access, and it's very helpful. So I find that that the ability to, and I have found, like I worked with one person with sickle cell, and she'd never had the experience before in her life of a good calm feeling in her body because she had sickle cell. So, you know, bringing other things in like smells, but she even had an animal that a stuffed animal that she had as a child that brought her that sense of regulation. So I actually find that the ability to self-regulate and find something that creates that regulation is pretty accessible and easier than doing that with another person. And not just
Okay.
but it could be the people I've worked with.
So as sort of a follow-on from that, Jennifer's asking, so, and maybe you can just, you've kind of answered it, but maybe you can just give a couple more practical examples. So where do you start with a client that cannot feel security, that has no sense of physical or emotional safety?
Yeah, and one way is what I was saying with sickle cell, like using something like a smell that they like through, you know, if they like lavender or if they like cinnamon, or like what is a smell that they would find calming and easeful, or is there a kind of music they might find calming and easeful? Is there an image that they like? So a lot of times it'll be an external object, just not another person. So that something exteroceptively is coming in and doing that. So a friend of mine who works in juvenile detention centers has used things like plastic flowers and things like that. So, you know, using something that through the eyes or the ears or smell that can cultivate a sense of ease. Not going all the way to safety, because that might be harder, but what is it that cultivates a sense of ease? And the more ease they feel in the body, then over time, the more safety they can feel. And gradually allowing that to become an internal image or an internal sensation.
Okay. And one more question. This is a hard one, but we're at time, so appreciate everybody who's still on the line. So Tara's asking, so what's the state of this this knowledge, this research in terms of the mainstream medical?
I would say it's very acknowledged in the psychological world. So like psychologists are really excited about it. They're really utilizing it. It's less mainstream, definitely in the medical world, and even less in the physiotherapy world. So it's coming more and more. It's just not really quite there yet. The state of the research, the heart rate variability research is definitely building. The research on polyvagal theory is much smaller, but it's building.
All right, thank you. And then just a comment, excellent presentation. We're getting a few of those comments. So yeah, I'd just like to reiterate that. That was fascinating. And thank you so much for being with us today.
Thank you. Thank you for your really wonderful questions and your attention. I appreciate it.
All right. Thanks. We'll see you later. And thanks to everyone who joined. Bye-bye.
Bye.